Good afternoon, friends. Today we have Dr. Girish Raheja with us. Dr. Girish Raheja is holding an experience of over 35 years in ENT department with Indraprastha Apollo Hospitals, New Delhi. Welcome to the board, sir.
Thank you.
So today, 3rd March is celebrated as a World Hearing Day worldwide.
Right.
So please share some light on this.
Hearing is one of the special senses of any human or any animal and is critical to his survival and also quality of life. Unfortunately, hearing was not considered as important in general as compared to, let's say, vision and otherwise. But as time goes by and we are evolving, we are beginning to address. As of today, we know that correcting hearing problems helps in children becoming more productive in school and college, adults becoming more productive at job, and senior citizens being more communicative and being able to overcome their handicaps to have a better quality of life. So, a World Hearing Day is very important to bring awareness to the community about the fact that hearing is important to day life all through our lives.
So usually in today's scenario, we have seen the children's either with the hearing loss since birth or coming up through their age. How would you like to share your view on this?
As a society, we must invest our best efforts in small children because they have the longest lifespan to go ahead from birth. Hearing loss at birth can be due to a variety of reasons. The most important reason is a mother having some kind of a viral infection, maybe a known viral like measles or chickenpox, and it may be a unrelated viral sometime in her pregnancy, especially in the first trimester, which may damage the inner ear while it was getting organized or it was developing. This child is likely to be born either with a complete hearing loss or with a partial hearing loss, which in the past was not detected for many, many years. And by the time we detected it, there was very little we could do.
So, what are the first few signs of hearing loss?
For a very small child, the first sign of hearing loss is that if there is a noise in the room, the child will not react to it. Usually, if there is a child sleeping and you make a sudden noise, the child will suddenly react to it. If your child at a very early age, in the first few days of age, is not reacting, or first few months of age is not reacting to loud sounds and suddenly reacting to a clap or a vessel falling down in the room, there is a problem. In smaller children going to school, the child may be studying very well, may be doing dictation at home very well, but may not score well in a dictation in school and class, which means the child is having a problem hearing the teacher from a distance and will have poor cognitive abilities or will be not faring as well in class. That needs to be checked then. A young adult, there's a meeting and the young adult is missing out on words being spoken in the middle of the meeting or by some people at the other end of the room. When other people are obviously catching that conversation, there is a possibility that this young person may be suffering from a hearing loss. Hearing loss is frequently seen in elderly after the age of 65 when people have retired, which is the commonest cause of hearing loss, which is age-related hearing loss. And in these people, typically, we need to repeat things more than once, excuse me, or the elderly person does not respond easily or will give a wrong answer to a question asked. So these are the signs that you can pick up that maybe there may be a hearing loss in the individual. Excuse me. Yeah.
So of course, children. And as you rightly said, that some are born with this disease. Going ahead with the what are the common signs in the adults with the hearing loss?
Like I said, that adult may not give an answer. For example, the words get mixed with the hearing loss. So a cat may sound like a rat. So if a person asks a question to this elderly person, he gets an answer which is not correct because the brain computes the word in such a way and gets confused with the original word. In presbycusis, that is the name, the hearing sounds is not bad, but deciphering the word becomes a problem so that the conversation can be difficult. So that's how we can make out that the person is probably suffering from a hearing loss.
So that's very well said, because in our community, usually the hearing loss problem, especially in elderly, is not acceptable. Even in today's scenario where there are a lot of remedies and there are a lot of medical sciences and solutions are available. And what you have to say on the age related hearing loss?
Over a period of time, um, because of much better quality of health care available to us and better nutrition, our longevity of life has increased. So people above 60 years have a healthy working life. A large majority of people into 75 or 80 years of age, and sometimes even after 80, people are not entirely retiring. Now, these people can either be screened routinely every second or third year with a simple audiometry test that can be done by one can do screening and pick them up, or even when they are picked up as a hearing loss and the family members and the children bring the patient to the doctor and we do a test and tell the patient, most of them are in denial of a hearing loss. They will say नहीं नहीं मैं तो ठीक हूँ, मेरे को ज़रूरत नहीं है. They often feel that the expense of a hearing aid on them is a waste, or at least they go behind that garb. And this lack of community knowledge that a hearing loss can be corrected just like we use spectacles to correct eye problems. We can use a hearing machine to correct a hearing problem, which will only give back quality of life, reduce chances of developing Alzheimer's and early Alzheimer's, which is one of the things that can happen if the brain is not stimulated, and will be an investment as far as we are concerned to have a healthy professional and personal life. So we need to increase awareness with elderly people that wearing a hearing aid is not a taboo and it is not cosmetically wrong or bad, and that cosmetic hearing aids are available today for the elderly. So we have to fight a social bias to get across with the senior citizens.
So, what are the various types of hearing loss? Like, I've heard that mild hearing loss and some great 40 dB hearing loss. What is this variances in the hearing loss?
So there are two different ways of looking at hearing loss. One is what are the types of hearing loss? One hearing loss is what is called sensorineural, which means the nerve is weak. This is a hearing loss that cannot be treated with medication and will require some kind of amplification device to help, like a hearing aid. The other hearing loss is called conductive hearing loss, which means the nerve is absolutely normal, but the patient is hearing less, like a patient with a hole in the eardrum, which can be repaired with a surgery, or bones that are stuck and not moving well, which can be repaired by a surgery, or maybe sometimes only a wax lying in the ear canal, which you just remove the wax and the patient gets absolutely all right. So conductive hearing loss is technically reversible and curable. And then you have a mixture of these two called mixed hearing loss, some nerve loss and some conductive loss in the patient. However, you grade hearing loss differently. You can grade hearing loss as a mild hearing loss. Decibel is the unit of sound, like centimeter is a unit of length. And we consider 0 to 20 decibel as being normal hearing, which means some people have slightly better hearing, some people have slightly less hearing, but they are normal. decibel, consider that as mild hearing loss, which means the moment somebody speaks a little louder to this individual will catch most of the conversation. After 40 decibel becomes moderate hearing loss, that means that this patient is unlikely to hear unless very loud conversation is made with that patient. So these are the patients who require help more.
So, sir, are there any ways to improve the hearing naturally?
Well, there is no tonic for improving hearing. Uh, Perhaps what can be done is if somebody has a tendency to have wax, he should go to the hospital and get the wax removed. That is the only way. But if there is a problem with the conducting mechanism, it needs to be repaired. And if the nerve is weak, then it needs to be presented with better quality sound so that it can hear better. So there is no real medicine for hearing loss unless it's a conductive hearing loss.
So, how and what tests do you recommend to the persons who once diagnosed with a hearing loss?
So when you suspect a hearing loss, just as when in a child in school you suspect that he is not seeing the blackboard well, you need to do a hearing test. It's a simple screening test, non-invasive, does not hurt. It can be done in any hospital or any setup where there is an ENT doctor sitting. And we give you a graph, and when we draw that graph, we can tell whether you have normal hearing or you have a problem with hearing.
So, and while looking for a treatment for a hearing loss, what all parameters one patient should keep in mind while selecting the hospital or a doctor, consultant? What all should, because we have seen these days the sometimes in the downline the areas, it's every corner shop we rectify the hearing problems. So we just request you to share some light on that so that patients need to be careful before going to any of this doctor for their hearing related problems.
Well, I would say that you should go to a large hospital in your vicinity. A large hospital is likely to have well qualified ENT doctors and have well qualified audiologists to test your hearing, have good quality machines to test your hearing, because at the end of the day, the doctor will depend on the test. If the test is well done by a well qualified person, it will show your problem. Sorry. As far as treatable causes of deafness are concerned, mostly a surgery may be required. Surgery done by a more qualified, better experienced surgeon with better equipment is likely to have much, much better results than a surgery done in a smaller place. The flip side is a bigger hospital also means a little more expense. But if you look at that expense as an investment with lesser chances of spoiling the ear or complications, then it's better to go to a large hospital.
So,
Pardon me.
can hearing loss be corrected completely, or it's always that probability of just getting it partially corrected?
We don't even claim for any patient of any kind who comes with a hearing loss that we will treat it completely. The whole idea of treating hearing loss is to ensure that the patient gets good, serviceable, workable hearing and he's able to enjoy his communication with fellow humans and with electronic equipment, which is so common nowadays, so that his personal and professional life is fulfilled. We are not here to correct anything 100% because there is no 100%. How to assure? If we can give a much, much better hearing than before and rehabilitate the patient and he goes back into society and is not dependent, that is what is important.
So, what can when a hearing aid is suggested to a patient, is it like for the 1 year or for the both years?
So for a long time in our country, uh, the hearing aid was a very poor quality analog hearing aid, which used to be body held, just put on the body with the headphone, very much like all you young children wear in your ears nowadays. And the quality of sound was very poor, and usually it used to go in 1 year. But many years now we know that uh, unless the hearing is corrected in both ears, we do not give the ideal correction. So we should definitely correct both ears. Also, with the advent of good quality hearing aids which are computerized and digital, the quality of sound is very much better. And the better we stimulate the brain, especially as we get older, the less chances that the brain will have a problem with dealing with the problem that you can see nowadays, primarily because people are getting older, but they are not being stimulated, not stimulated by good eyesight, not stimulated by good hearing, not stimulated by the fact that they can be economically productive, not stimulated by the fact that they're not as socially active. So, good social interaction with good eyesight, good hearing is likely to keep people healthier and younger for longer.
So there are a lot of myths and facts in regard to the hearing. I take it one from each age group. Like for example, in children, people with the child who starts speaking speech less, or at the by the age of 5, people parents sometimes feel, oh no, it's common among the kids and it will get rectified by themselves. Is it a myth or a fact?
It's a myth. Um, so that's why we should go to deliver your child in a hospital where there will be newborn screening. Newborn screening means that there is an instrument used to find out if this child is likely to have a hearing loss or not. If there is a hearing loss in a particular child, then that child is followed up closely. Just like in adults, if brain stimulation does not occur with hearing in small children, the area of the brain that gets stimulated with hearing actually closes down. So, if we have to do something special for a child with a severe hearing loss, it has to be done before 4 years of age. After 5 years of age, putting a cochlear implant does not give good results. So, if a child is born without hearing, then a cochlear implant needs to be put in as early as possible, and we prefer to put it in the first year or two now so that the child grows up hearing normally. But after 5 years, we start telling the parent that the result is going to be or not likely to be very good.
So similarly, from the bracket of the adults, does frequent air travelers suffers from hearing loss?
Yes, usually air travel in our country is becoming more frequent now. Younger people are better educated. Um, the business is very often spread across the country or across the world. People have to travel, and air travel has become both affordable and possible because of more aircraft, more airlines, more airports, etc. The problem is with some people who have a tendency for a cold. Sometimes during landing, the tubes that ventilate the ears get blocked, and the ear gets filled up with fluid. Hearing. This hearing loss is usually reversible. It settles down in a few weeks, but sometimes we need to do an operation to take out the fluid and settle it down. So this is a thing that was not common. We call it barotrauma of the ear. But we are seeing it more and more because young people are traveling both for work as well as for pleasure. So we are seeing it more often, yes.
So similarly, one category is the putting up of the earphones to the maximum time for the conferences or video conferencing, especially in the IT industry these days. So does it also affect the hearing loss?
Using excessive use of electronic equipment in the ears, um, Unfortunately, we don't have a lot of data available in spite of the fact that so many millions of people are using, let's say, the mobile phone or the headphones nowadays. However, having said that, we know that excessive exposure of the ear to loud sounds, as in a headphone or the earphones, as we see small children using them, all ages, is likely to cause what is called a noise induced hearing aid loss beyond a few years. So, we expect that in the coming generation, we will find people with hearing loss because of excessive use of headphones. As far as mobile is concerned, there are concerns that the microphone radiation, the ultrasonic radiation of the headset may actually damage the nerve endings of the ear and also, frankly, damage some part of the brain, depending on how intense the radiation is. But there isn't any definite data or evidence available to say that we should not use the headphones or to use the mobile phones.
So going towards the elderly age, it's very normal among that the age hearing loss at a elderly age is not reversible. This cannot be corrected.
Right.
Again, is it a myth or a fact?
No, it cannot be corrected. The problem is that a lot of people come to the ENT doctor and say that if it is age related, why should it need correction? That is the bigger problem. So I prefer to tell people that if they get a cataract in their eye at the age of 45, 50, do they not go to the doctor and get the cataract corrected? After all, that is also an age related, uh, loss of vision. So people have to realize that if they are going to get older, they will have some problems. They will have issues with hearing. They will have issues with their knees, and all these things, whichever is correctable, only helps the.
Right, so that's I believe a very useful information to our viewers on the hearing loss and related problems. I believe they will keep in mind the precautions and the preventions you have suggested to go and follow in their daily lives. So thank you very much. What will be the key message to take home for our viewers today?
The key message is that it is important to screen your hearing. For a small child, as soon as he is born, for a child in second, third class, the screening is very important because that is going to be the formative years for language and for studying and for performing in school. In a young adult, almost every child should be screened as he passes out of school or college, and not just for employment, so that we can make out if there is a child with a problem, we should rehabilitate him quickly. And as we get older, we need to invest in improving our hearing so that we remain younger and productive as we get older.
Thank you so much, sir. Viewers, if you have any question, any query regarding to the hearing loss, or you want to meet Dr. Girish Raheja at Indraprastha Apollo Hospital, Delhi, feel free to connect with us at askapollo.com. Take an appointment. You can come and meet him over there. Thank you, sir. Thank you for the day.
Thank you.